want not to be in the recorded session, just let me know and I will remove them. And with no further ado, I really want to thank Dr. Lebow for joining us today. Dr. Lebow is a leading ER physician in LA, experienced and compassionate, which are a rare combination. And thank you for joining us today to share with us, based on the 3 months that have passed, what do we know now about COVID-19 that we didn't know before? What should we be aware of, and how to start getting back to the new normal? What does it mean? What do we still have to keep doing to make sure that we are, keeping ourselves
safe and happy? Yes.
Exactly.
Well, I want to say thank you for having me, and I always enjoy speaking to anyone about, especially about COVID. It's such a new thing that we're all dealing with, and now that we're into it for a while, I do want to talk about reemerging from our cocoons that we've been in. There was a landmark study about patients with cancer and COVID, and we can talk about that, maybe go beyond the headlines, and just talk about testing, which has become much more common, and what kind of test you want. It all seems very, very confusing to a lot of people, including doctors, and I spend a lot of my time explaining testing to doctors as well. But let me start off by saying, answering your first question, yes, we are, society is slowly getting back to normal. I was interested in hearing earlier about hair salons and things like that. My wife took me to get my hair cut yesterday. The place where I get my hair cut opened here in California on Thursday. So it's been Los Angeles is slowly opening up. Other places are ahead of us, behind us. I would say a couple things about this. As people have become perhaps a little less cautious than before, those of us at risk should not lose sight of the fact that it's the same COVID germ, virus that caused it before. There may be a little mutation. Some say it gets a little worse over time. But the main point is that as we see society open up, you still need to do the same things that you've been doing. Remember, as we go out into the environment, probably we're thinking that one of the main reasons that people pick up COVID is through touching something and then touching your face. There was a recent, here in Los Angeles, there was a hairdresser that unexpectedly tested positive. She had done 117 hair appointments during the time she was positive. Not one person got COVID out of that. So it makes you scratch your head. Well, how is it being transmitted? And certainly being close to somebody who's talking to you, who is because the act of talking or coughing spreads a lot of the virus out. We think that the touching to the face is probably a very, very important, maybe more important than we initially thought. So my message about that is to continue to wear your mask, even though you see some people here in California. I see a lot of people not doing it now, but you still have to do it, especially those of us who are a little older or have a health condition. The second thing is, even if I'm one of these people, I'm always fiddling, always try to not touch, when you're out, try to not touch your face as best you can. Just like keep your hands away from your face when you get home or in the road, or keeping a sanitizer with you. Always be washing your hands. You should do this for 20 seconds. And what's the most important part of your of your hand, you might remember this from the last time, it's the fingertips. We always wash our hands like this, but the palms are not in contact. It's the fingertips. So just like if you've ever watched on TV how a surgeon scrubs up, they always scrub their fingernails. You've seen that before. That's where you want to get it, your fingertips. And then being mindful where you're at. Things like, I heard somebody talking about their keyboard. That, now I wouldn't pour bleach on it or anything like that, but things like, especially if somebody is using it besides yourself, using a cloth to clean keyboards, doorknobs, other things. Remember, light switches, countertops, bathrooms. Those all should be, you need to still be mindful. And those are the things that we've been talking about, and all of it still goes. COVID has not changed. We've changed, but COVID has not. So we have to still be careful. The next thing, and of course, should I keep going and answer questions at the end, or I can do it either way?
No, I said let's keep going, and then we'll do the question
Okay.
Later.
I wanted to talk about, because some of you may have seen, there was a very large study of patients with cancer and COVID, and one of the headlines was that people with cancer and COVID had a fatality rate, 3 times higher or 2 times higher than the normal public. Well, I'd like to say a few things about that. The people who, the normal fatality rate in the US right now it's probably lower than this because of people who are asymptomatic who have not been tested, is about 5%, and people 5 or 6%, and you can see that on your daily news where there's 2 million cases and 115,000 fatalities, so about 5.5%. The people with cancer doing the study were about 13%. Now that seems like a large increase. However, remember, I would say a few things. 87% were discharged and got over the disease of COVID without a problem. And some of the things they found were that men seemed to be affected much more than women. For women, it was, as we said, the normal rate of fatality rate right now is 5.5%. For women with cancer, it was 9%. Not even really twice the risk. For men, it was about 15 or 16%, but the sample was a little older. And then they broke it down into people undergoing treatment and those who were not in treatment. Those people who are not in treatment at the current time and were not actively being treated were pretty much no more likely to have a bad outcome than somebody without cancer. So they were pretty even. And it turns out that probably the risk factors are those medications that affect the immune system, and of which of course many people are on. So the things, everything from a small increase of people who are on steroids to many of the chemotherapeutic agents, those seem to be the culprits. However, as long as even with those facts, most people did okay. For most people, it's still a bad viral illness, and so it was hopeful to me when I went through it. There are a lot of diseases with outcomes worse. For instance, those people with COPD from smoking, smokers were many times more likely to be affected and things like that. So I think that's the message, and I didn't want anybody to feel like that somebody with cancer who got COVID, it was like the most terrible news. It's not good news, but however, most people, 87% did okay. And then a lot of people, and I'll throw it open to questions in a few minutes. A lot of testing is being done, and we're finding that there are a lot of asymptomatic patients who have no idea that they have COVID. And as we test more, we're finding more of those. The problem with COVID testing is that there's a lot of, it's not very accurate. You may have heard or not heard that it's not particularly very accurate. So when we're treating a COVID patient, we're going more with how and I'm teaching the younger doctors, ask how a person feels and if they're, when do you get over it? It's basically, you can't trust the test sometimes. It's how does a patient feel? If somebody feels like they're getting better, they're, whatever the tests say, just follow their clinical path, how a person is feeling. And so the testing, I encourage anybody, you should be tested, and probably your doctor is asking you to be tested before starting any new medications. And if they're not, you might suggest it to your doctor to do that. But they're not as accurate as we'd probably like them to be. So we're still the most important thing is how you're feeling. And if you feel like you might be coming down with something, talk to your doctor, get tested, and those are sort of my recommendations. So those are sort of the new things that and what we're talking about in the medical world right now. And I wanted to open it up and see if I could answer any questions. This is a Q&A. So please feel free to ask me anything. And if I don't know the answer, I'll tell you. But we've seen a lot of cases. So does anybody have anything?
Question.
Sure, go ahead.
Thank you. I have two questions to you. First of all, thank you so much for coming to talk to us. First question, I wanted to ask you about the antibody test. Would you, because I feel like I want to wait with testing. As you said, it's not, who knows if I have it or not, maybe I should wait. Would you say that the antibody test is more accurate than the negative positive test?
No. Okay, the antibody testing. Oh, what a headache that has been. The antibody tests have not been particularly accurate. In fact, just last week, finally, because what happened was they did emergency authorizations for a lot of tests that were not very good, and there's about 40 different antibody tests out there. The federal government just removed 28 of them. So there's now about 20 tests that they're leaving in the marketplace. The problem is they're not particularly accurate. Now, let me explain what the antibody test does. When the different kind of tests are, the initial test to find out if you have COVID or you don't have COVID, it's called PCR. That's the nasal one. Now, some are all the way back. The newer that go, you tilt your head back if you might have had this, and they test all the way back. It's a Q-tip this long, and it goes all the way back. The newer ones are shorter, and they test inside the nose. What they're testing for is the COVID virus. And what they do is they look for the DNA or the RNA, to be more specific, the RNA within the COVID. That's what they're testing for. That if they find it living in your nose, then they're assuming that it's living everywhere else and you have COVID. And most people that are symptomatic have it. That turns positive on day 3 after an exposure. So it might be positive even a day before you're symptomatic although most people, it turns positive about the first day that they start feeling lousy. And that tells you, do you have COVID? You don't have COVID. The problem with that test is you can't use it at the end to say, I don't have COVID anymore, so I'll check to see if I've got it. The problem is it stays positive for several weeks because it doesn't differentiate between live and dead virus. It's just testing for the RNA chemical within the test. But regardless, the PCR test, the nasal test, that's the one that you get first. The nasal test is to see, I have it, I don't have it. The antibody test is this. The body, and you as a group are probably the most educated group of people I talk to, because you understand immune system issues probably much better than the general public. So I'll try to not be, I'll try to keep it at a slightly higher level. As you know, once you've been exposed to a virus, your body forms antibodies. And this is how we fight certain cancers as well, through our body creates antibodies. Antibodies hook onto a virus, they hook onto the wall of the virus, they break it open, and they kill the virus, because the virus needs that wall around it to live. So that's what the antibody does. The antibodies show up, are measurable at about 15 days is where the 50% will be positive at about 10 or 12 days, but 80 or 90% by day 15 of your illness, you will have a positive antibody test. Now, there's two kinds of antibodies, and I don't want to get into them because most people are just measuring the long-term antibodies, so let's just talk about that. Once you test positive for that antibody, the IgG antibody it's called, once you test positive at day 15, then you'll remain positive, we think, at least for a couple years. So they would be able to test your blood now or later. Now, there is a short period between when actual nasal test and an antibody test can be positive. That would be about, because if COVID lasts in a regular person without a lot of secondary problems, maybe about 14 days or so, 15 days. Some people will be a little longer, so it's possible to have both positive, but generally speaking, we think of the antibody test as not as saying I had it in the past, but I don't have it now. So the two tests are the nasal test, do you have COVID or you don't have COVID? And the antibody test, did I have it in the past or I didn't have it in the past? One checks for disease now, COVID disease now. One checks for earlier, checking back. So there's no rush to get an antibody test. What we're finding where it doesn't really affect clinical that much. What it affects is perhaps your risk. However, we don't, even if your antibody test was positive and said, you know what, I had a mild test, a case of COVID. I'm so happy, and now I have antibodies to it. The problem is, there's a couple of problems. Number one is the test is not that accurate, and sometimes it will test for another kind of COVID that might have been, COVID's been around for a number of years. And this is, there was SARS that you might remember years ago. That was a COVID. And we think that some people who had SARS are still IgG positive for COVID even now. So it's a little inaccurate in that case. And then, the second thing is that we don't know 100% whether this antibody is a protective antibody. In other words, is it an antibody that will neutralize COVID? And the reason this is important is the question, can somebody get COVID twice? Well, in most cases, we don't think so. However, there are a couple of cases where people are pretty sure that it wasn't, that the tests were inaccurate, that the person actually did get it again. They're rare. And the reason is that antibody that we're getting, at least the ones we're measuring. Now, there may be others that we're not measuring, which I'm hoping will be what's called totally neutralizing antibodies. For instance, if you get a mumps and measles, an MMR, mumps, measles, and rubella shot, those are antigens, and your body forms antibodies, and it will kill 100%. They're neutralizing antibodies. If a mumps germ gets inside of you, your antibodies will go in and neutralize it immediately. Does the IgG antibody for COVID do the same to COVID if it comes back? We don't know 100%. We think that it's protective, but there's been enough cases that it makes the experts question whether it's 100% effective in stopping. So what's the answer? What do? You continue to use social distancing and masks and the things that we talked about already. So what we've been doing a lot of antibody testing, because a lot of people who are opening businesses, say they're opening a factory or opening a bakery. We just did a bakery. They're interested in knowing what the status of their employees are. So they want to check antibodies on people. And I've explained to them what I've explained to you, but they want to check what is our risk as a group. And they think that's probably the most use for antibodies. On the other hand, we also at our clinic, we're near LAX, we test there's certain countries, for instance, Tahiti Airlines sends every person, before they can get on a flight to go to Tahiti, because there isn't much COVID in Tahiti, they have to come over to our clinic and be tested for the nasal COVID. They're not interested so much if you had it before or you didn't have it before. They're interested, do you have it now? And so they come over to the clinic, we do a nasal swab, we generally get the results back. We're down to almost 24-hour turnaround now with the lab, because we do a lot of them and they'll do the turnaround. So it depends on the situation whether it's important to test to make sure that people don't have it, or whether they had it before or not. It's not as useful information. So that's what I'd say about the antibody test. I think that at a certain point, you know, if your doctor is drawing tests, you know, they should draw an antibody test to see if you've got COVID. But it's not as useful as you might think. And knowing that you had it before or didn't, you still should, it shouldn't change your behavior that much. So I think that's how I'd answer that.
Thank you.
I hope that was clear.
Very clear.
Okay, thanks.
Excellent.
Go ahead.
I have another question that I will wait for the round two.
Okay. So hi, thank you so much for being a part of our day. Seriously. So I have had CML since 2008. I take medication every day. That's a leukemia. I also have MAC in my lungs. So I had been tested at the beginning with that lung thing. It came back in 5 days and it was negative. So, which was amazing. So, but yesterday I went to visit my oncologist, and he said, because we talked about masks, and he said that more than likely I will probably need to wear a mask until there's a vaccine that comes out. Is that true?
I would agree with that. Listen, I agree with that, and I'm going to be wearing a mask until I don't like it very much, but you know, that's what I'm going to do. And
Okay.
certainly, if you know, going in and working with patients, I do a lot of telemedicine now, but you know, I would the reality of the situation is that if you're high risk, and I think most people should be wearing masks on it, especially in an inside environment when you're out in public until until there's a vaccine. Hopefully there'll be a vaccine soon, but I have to agree with your oncologist, and I'm resigned to it. I have to say I'm going to be wearing a mask when I'm out, and I you know, I just keep them around me, just like I take my wallet, I take a mask, you know.
Right.
It's part of
I
life.
know. Right, I have probably like 20 of them now. My other question is, if I were to go, and have not, actually, I've only been out 10 times, but if I were to go to a restaurant and they do social distancing, you can't wear a mask when you're eating. So obviously that means that I'm not choosing a restaurant.
Well, that's sort of a personal choice. You know, I just gave a talk on a station about eating on flights. This is a little bit off subject, but let me try to answer it this way. People, you know, that people are traveling more, and my suggestion was that somebody asked me a question almost like yours. I have to wear a mask the whole time I'm in the airport and the whole time I'm in the plane, and how am I going to eat? And my answer was that you probably should wear, you know, it's an area with a lot of people and a lot of mingling and a lot of touching, and you don't know what's going to happen. And my suggestion is that, you know, before you take a flight or before public transportation, that you eat ahead of time. And then people who you know, that you carry snacks, nutritious snacks, things that you can eat by slipping it under your mask, things like pieces of fruit or an energy bar, or things that you don't need a knife and fork, because you will have to take off your mask. Now, I think that to make a decision about whether you go out to eat or not before there's a vaccine depends a little bit on how much COVID is in the environment. How many in the environment? I mean, how many people are testing positive sort of on a daily basis in your area? Here in Los Angeles, it's very strange. There's about 1,200 new cases. There were, when they were not social distance, when there was, everybody was home. It's about the same now. I don't know what to make of it. You know, it might go up because of the demonstrations and things like that. So it's at a fairly even rate here. I think if you're in an area where you see the rates going down, and it's a place that has a good reputation of being clean, and that you see the waiters and waitresses are wearing masks and gloves when they present you with the food, that they have paper menus that are thrown out. Remember the touching business, and that, you know, I think that at a certain time it might be okay, I think it's place specific. If it's an area where there's a lot of COVID, I probably wouldn't do it. I think in an area where there isn't too much, where the number, there are certain places in the country where the numbers are down pretty low. And then I think that it's probably okay to go out. And then when you get home or before you leave, you know, you keep washing your hands before you eat. And as soon as you're done eating and things like that. But I think that it's like a lot of things in life. It's a risk benefit calculation. So
well, and I probably should have prefaced it by saying I live in Las Vegas.
oh well, yeah.
So I mean, I'm
that's,
not going right. I'm not going down to the Strip, but I'm just talking about local restaurants.
well, I think that I would, you know, certainly I would agree that the Strip is not the best place, or downtown or anything like that. However, I probably would avoid them right now until we see what's going on. You know, I thought that I was very, very hopeful before all this stuff with the demonstrations, or however you want to describe them, and I don't know what's going to happen. So I think that just delaying a little bit longer and seeing, maybe we'll get back on a downward trend that will be sustained, and then I think, you know, you can make a better assessment. But I think right now I probably wouldn't. My suggestion would be not to at this point.
Okay, I have a question. So, thank you for being here.
Oh,
so,
sure.
When I think about the regular flu and its vaccine, what it does, of course, is it doesn't completely prevent us from having the flu, but it greatly decreases the possibility of having it. And if we were to get the flu, it makes it less severe. That's my understanding. And
Yes.
I'm wondering, these vaccines, the different ones that may be coming out against COVID, would they look like that? Or would they be a guarantee, or what?
Well, your typical flu vaccine every year, the flu vaccine, the reason why we don't have long-term immunity, what's the difference between the flu and what we were talking about earlier, mumps and measles, where you get one shot, you're done with it, or if you get it once in your life and you never get it again.
Mutation.
Well, the reason the flu is not like that is because the flu mutates. And to make it even more complex, there's influenza A and there's influenza B, and there's a couple strains of it. So what they do is they look at how the flu has been changing from year 1, year 2, year 3, and then they make a guess based on the history, what will be the next year. And they make an educated guess, and sometimes they're right on the money, and we see very few severe cases. We almost never see no cases. As you point out, it almost never takes it away, or it never takes it away. But the mortality rates are generally somewhere between, in a good year, there'll be 10,000 mortality. In a bad year, it might be 75,000. So it can vary quite a lot, but it's helpful. And without, you know, if we didn't have it, the mortality would be much, much worse. COVID is, this is where we're learning about how much is COVID changing on there's been some little changes from the beginning. Initially, we thought, the reports that I was reading said that we think that this COVID virus that is causing COVID-19 does not mutate very much. However, that's not the case. It does mutate. So most likely they'll come up with a virus sort of like the regular flu. It will perhaps make it so that it's nothing more than, you know, if you had the flu shot and get the flu, a lot of people get it for about 2 days. You know, they'll feel they'll have sniffles and achy for a day or two, and then by the end of 3 days they're pretty much okay. You know, and it's just and hopefully it'll be something like that, and hopefully it'll be soon, so we can get our lives back together, and hopefully it will be easily distributed. Remember, those of you who can remember the Salk vaccine on the sugar cubes that we took when we were children, and you know, that were given out at schools and everything. I don't know. Sometimes I think that things used to work better then. I don't know, but we were all, you know, it got done very quickly. And I'm hoping that, you know, we'll be able to find a virus and it will get distributed. And then once that occurs, then we will be able to resume normal activities. And I'm pretty hopeful that will happen, but I don't know when. And I think that probably, you know, you hear some people saying before the end of the year. I think maybe by the spring, but maybe I'll be wrong. I don't want to say, you know, it would be not a good thing to say I think it's going to be ready soon, and it's not, because I don't think that. However, I'm optimistic that by springtime next year, so maybe in 7 or 8 months or 8 or 9 months, but maybe less than a year, you know, but probably not less than 6 or 7 months, you know, something like that.
So I have a question.
Sure.
Thank you for being here, by the way. You know, they talk about the underlying conditions.
Yes.
And I have high blood pressure, but it's managed by medicine. So medically, my blood pressure is okay. Does that mean I'm still, you know, living with a high risk underlying condition?
Not necessarily. It looks like that people thought that hypertension was going to be a large risk factor, and it turns out that when people, if somebody with hypertension on hypertension medicines becomes COVID positive, the recommendation is to keep taking your blood pressure medicine to maintain good control. There may be a very statistically small increase, but how much of that has to do with the fact that people, in general, people with high blood pressure, based on the general population, are a little older. Maybe that's got something to do with it, you know. So I think that it would be called a minor risk factor, but the best thing you can do is to do what you're doing, which is to maintain good blood pressure and keep taking your medications. And if you do those things, it doesn't seem to be a big factor at all. It's very minor, and it might not even be the hypertension. It might be some other factor that is common to people with hypertension, but it's not the hypertension. So what's common to people with hypertension? Well, a little older than, say, just a statistical person. So maybe that's all it is, but it's not much of a risk factor.
Thank you.
Hi, this is Diane. Thank you, Dr. Lebow. I sort of have all of the characteristics of extreme vulnerability, like asthma, diabetes, under control, weight, A positive blood type. You know, I feel like I'm walking around with targets on my forehead. And so I have been really careful. I hardly go out. I order food in. There's only one friend that I see, maybe two, and we kind of distance. So I have two questions. One, is there any reason for me to get tested? And two, there's a lot of peer pressure to do things in my neighborhood. You know, they sit out side. In the beginning, you know, they sat in somebody's driveway, you know, 6 feet apart with masks, and now they have a tent and they're practically in each other's laps, you know, and I don't feel comfortable, and I try to tell them, but is there something I can do that doesn't sound too preachy? But I'm, you know, I'm worried for my life. You know, this is not.
And, well, you should be. Okay,
right.
let me answer your first question first. There's no reason to get tested, because
Okay.
if you don't have symptoms and it's negative, what does that do for you next week? Or
No.
if you're like the president, get tested every day, I guess that would be all right. But we don't get tested. A normal person doesn't get tested every day. It tells you, do I have it today or I don't have it today? It doesn't help you for next week. And so, and remember what I was saying earlier, what I tell the doctors, especially the young doctors who depend on tests. I said, look at the patient too. If the patient has symptoms and the test is negative, you better still treat the symptoms. You don't tell somebody who's suffering that they don't have something because the test is negative. It's more likely the test is wrong and the person's right. And the second, and the opposite is true. If you're not symptomatic, you don't need to be tested, because our tests are 95% accurate. That sounds good, but it's not very good, because that means that 1 out of 20 people, 95% is 1 out of 20. 5% is 1 out of 20. It'll be the wrong result. So I would encourage you to be tested if you get symptomatic, if you're not symptomatic. The second question is exactly what I talked about when I came on, because I was anticipating this question. That people have changed a little bit in their attitude toward COVID, but COVID has not changed. And those of us who are at risk are still just as much at risk from before. So I think what you're doing is perfectly the right thing to do. It's perfectly logical. I would not, certainly that when you see people not getting too worried about it, that might be they're in a very low risk class or something like that, and it might be all right for them, but it's not all right for all of us. And I think that you need to continue to do what you're doing. I think you're taking all the right steps. Your day will come. The vaccine will come, and you'll get an appointment, or somebody. Hopefully, they'll have some system where people are social distancing until they get the test. That's what I was talking about, the delivery system. How are we going to deliver it to everybody? How are we going to get, and so you'll keep in touch with your doctors. But COVID has not changed. People have changed. You still have to maintain social distance. If you're at risk, like many of us are, nothing has changed. The laws have changed, and the people have changed, and the politicians have changed their tune, but COVID doesn't care a bit about any of that. So I think you're doing the exact right thing.
Thank you.
I wish I had a better answer, but if it will give you some peace inside of you that you're continuing to do the right thing, then I would take that for what it is. That, you're exactly right. And to everybody, I'm sure feels exactly like you feel, that I see people that don't seem to even care about it. And for a young person, that's probably okay. That's probably, what did we talk about? The risk and benefit calculations before. Maybe for them, the risk calculation is okay. But it's not okay for those of us that are older, at higher risk, and it's just the way it is. So, I spend so much more time at home now, but I don't find it greatly oppressive. It could be worse. Things have been worse.
Yeah.
So that's how I'd answer that question.
The interesting thing is, this is an over 55 community, so everybody you know, is not elderly. I'm in my 70s, but some of them,
Mature.
yeah, that they're all,
Yeah.
you know, at higher risk. And
Yes.
whenever I tell anybody, I say, you know, I'm just not comfortable being in a crowd right now. They look at me and go, you know, me too. And I'm thinking, well, you know, why do you do it? And I don't know. It's the strangest phenomenon, but
Yeah, it's really not good judgment
yeah.
to put down your guard yet. It's just not. The cases, you know, because there's been a lot of other news lately, there's been a de-emphasis of it, and maybe that's good for some people. Maybe it was being emphasized too much. But those of us who are at risk need to be mindful, like we have been up to this time, and continue to be that way. And look, it's interesting to me that you said that the people there, some people are bowing to that pressure, but they should be, they're not doing themselves or their loved ones a favor by behaving in this way.
Go ahead.
Thank you again for your time. It's terrific information. I have a question about surfaces. I have a husband who's severely immunocompromised, so we've been staying in 99% of the time. We sit outside the building for an hour a day, wearing gloves and masks, and that's kind of it. But I want to know, there's been some change of information on the part of CDC as to what you need to do with groceries, with mail, with everything else. I've been, spending hours spraying my groceries before I put them away. What's the latest on that? What is the risk from surface contact or sitting on a bench or anything like that?
Well, I don't know that they've changed that much. The details have changed, but the same. If you're severely immunocompromised, look, we've done the same thing. Just quickly, if there's say for instance an Amazon package that we'll open it outside, and then quickly wipe off whatever's inside, leave the box outside and things like that. And maybe that's overdoing it a little bit, but I think keeping those good habits are they're good to. It's better to overdo this. You don't want to be crazy about it, but taking an extra step is not wrong thing to do. And I'm not sure what changes exactly you mean, but it's still important to keep, to keep the surfaces clean and to avoid, and you don't get it through your hands. It's the hands to the face that gets it. So that's what the danger is. So we wipe our surfaces so that we don't touch and go like this. So I think what you're doing is perfectly okay. And look, when we go outside or we go, when my wife took me for the haircut yesterday, I mean, the barber, the hairdresser was cleaning in between people, like you could, no more hair on the floor and everything. All the surfaces were redone, and it took 10 minutes for them to clean the whole area between individual people, where it used to be, you get up and the next person sits down. And I think I would just go through that little exercise. Is where will I be? Let's make sure this area is nice and clean. And it becomes a habit after a while. And it's a bit of a pain, but the alternative is so devastating that I think the price to pay, I look at it as not being particularly high. It's inconvenient. It's very inconvenient, but it doesn't cause pain, and it's not life-threatening. And so I have that attitude toward it. So I don't know if that helps with your question exactly, but the CDC is still, and in the clinics, we're still surfaces, doorknobs.
A specific question here is, I have all my groceries delivered. I spray all of the boxes, all of the bags, anything that comes in, any plastic container. And I had heard recently that the CDC said you didn't have to do that.
Yes, I remember what you're talking about. Yeah, that was fairly, yeah, they're saying that you don't necessarily have to do that. I think it's if the grocery store is being conscientious and they're loading it in a way and they're checking their employees, there's probably a very, very low risk of bringing COVID into the house through groceries and things like that. However, wiping them down quickly, doing a quick wipe, I don't think that's wrong to do. They didn't say not do it. They said that it was probably not necessary, and it's probably not for most people. However, I just fall back on being a little extra careful,
Okay.
so.
Yeah,
Thank you. Thank you.
Last question, anybody?
Oh, Tzvi, I have 2 questions.
Yeah, I'm conscious of the time and I want to announce something for next week, so choose one.
Quickly, because a lot of us are dealing with clothes, I wanted to ask you, because you
Dealing with what?
clothing, like clothes, fashion.
Oh.
And you talk a lot about if I touch something, it's okay. Even if it has COVID, it doesn't mean I have it unless I put it on my face. So it's really putting on my face that will give me the COVID. So what if I try on a dress in a store? I have somebody else's body on me. I put it back. Do I need to steam it before I wear it again?
No, I don't. It depends on, of course, your risk level, but like we were talking about with the groceries and things like that, if it's not, if the disease is passed one of 2 ways, aerosolized, so somebody's close to you, but it doesn't seem to be just, if they're within if they're outside the social distancing range or inside it with both people wearing a mask and talking for a short time, that doesn't seem to be a big risk factor. That would be one way. The second way would be to touch something and then end up with the germ on your finger and then going to your oral nasopharynx or your mouth, or some people even say the eyes, the sclera of the eyes.
All right.
If you're just touching, I think that in this instance, continuous hand washing is the best way. So you hand wash before, after you've tried on the dress, and you should wash your hands, because we all end up having a little itch on our nose or something like that. So I don't think that you need to do anything with the dress itself, but but I would just wash my hands,
Right.
before and after.
Thank you. Thank you. Thank you.
Thank you, Dr. Lebow. Thank you so much. So
Sure.
related to this discussion and about the risk factor that is not changing for those of us who are at risk for some odd reason or another, I'm really excited to let you know that we've partnered with a company and together we will be launching an app that will be free for all of the community, that is basically based on the CDC guidelines. It's a monitoring COVID-19 app. So it's a program that lets you monitor your symptoms. So you can actually, instead of saying, I felt bad the other day, I didn't, how is it compared to today? You actually document it, you log it into the app, and then you sort of see the trend over time. And then if you have a concern, or via the app, they start to see a trend that could be alarming, there is a call center of certified nurses that certified and went through training to deal with COVID-19 issues that are there to help answer any question, identify the trend, and alert you when you need to go get tested and see a doctor. So it's something that can help us as things start to open up, still be in control of our symptoms and get the assistance and support we need for the risk of COVID-19. So it's a special program that was that was designed also for employers, etc. And we got it for the community to be used for free as a service because we are at risk and because we need to be extra careful and life goes on. So we need the tools to assist us. So we will launch it and we'll send you all emails how to download and everything next week. And then next week in the 4 o'clock session, we'll have the program, the trainer from the app developer to guide us through how to use it, tell us about the functionalities, tell us about the call center and the service that is available for us, again, for free completely, just to help us throughout this period. What did you say, Dr. Lebow? Until next spring? Until next spring.
Let's hope. Let's hope
Yeah,
so.
I think that's an optimistic.
Thank you, everyone.
Thank you, everybody. Have a great
No,
weekend.
thank you.
Thank you.
Well,
Thank
I
you.
enjoyed speaking with everyone, and so good luck, and we'll see everybody the next time.
Thank you. Bye, guys.
Great
Bye-bye.
advice. Thank you.
Everybody.
Hi, thank you so much.
Thank you.
Doctor.
Okay.
Well, Tzvi, are we doing it one by one? Hold on, don't leave.
Yeah,
Hold
one by
on.
one. I'm here. I remembered. I didn't lock everybody out.
We're not just,
I remember from last week. So one by one, as you depart, I keep it open and say, wish everybody a great weekend. Enjoy the good weather. Stay
He was-
healthy.
and Tzvi, I thank you. He was excellent.
Oh, he was
Really good.
fabulous. So kind.
I
and so
told you that.
informative.
He's really kind. And if there's additional question that you thought of after that you want to ask, just let me know and I'll connect you. And we will send it to him in private. Don't worry about it. He's always available to answer any question that pops to mind. And I think this new program with the app and the call center of nurses will also be a very valuable resource. Also.
Yeah, I mean, really answer the humanity part. And it reminds me, Caroline on the call, you mentioned something about your friend in assisted living. It was stuck in my head the whole week, that she's alone and she doesn't see anyone, right?
Yeah, and they have two more for people, 2 patients and 2 more helpers have been diagnosed.
Wow.
Oh, wow.
I sent her the link. She may be watching today. If not, can I send her this?
Yeah, it will be on Facebook, still available, and I'll send everybody the link. I've recorded everything so everybody can see. Send her the link to watch it. It will be
Thank
online.
you.
So Aline will post it on